Let's now talk about the quality of air that we are breathing, or air pollution, which has been established to be the second largest risk factor of death and accounting for the death of some 700,000 children in the country. But before we get into the nitty-gritties of the conversation, there's a story that you need to watch. With 2,772,157 non-communicable disease cases since 2020, asthma ranks third, trailing only hypertension and diabetes mellitus in Ghana. Even more concerning, 36,780 new asthma cases emerged from January to June 2023. For these sensitive individuals, worsening air quality due to vehicle emissions compounds their struggles. In this report on air pollution's impact, we follow Ruben, an asthma sufferer for 17 years, illustrating the grave consequences of deteriorating air quality. And when we come back, we get into the conversations. Here's the report.
In Accra, the familiar sight of cars trapped in a gridlock is an everyday occurrence. However, an unsettling reality accompanies this urban tableau. A cloud of thick plumes of toxic fumes emanates from many of these. These harmful emissions infiltrate the lungs of millions, regardless of age, with lethal consequences that unfold over time. These vehicular emissions are a cocktail of exhaust gases such as carbon dioxide, carbon monoxide, nitrogen oxides, hydrocarbons, and particulates, sometimes too small for the eye to see. For many residents, particularly those with heightened sensitivity, this smog is gradually transforming from annoyance into a genuine menace and silently causing harm, with thousands paying the price for every breath they take. Ruben Alexander Otu knows this all too well.
It's not easy. It's a difficult moment, especially something you can't breathe as you do so often. It's challenging breathing, especially at night when you are asleep.
Ruben, like many Ghanaians, had to board commercial public transport to their destination. From Gawe to Kolebu, Ruben boards two separate vehicles.
You encounter different kind of cars with their smoke from their exhaust pipes, very bad, and they are not the best.
The journey is far from comfortable, and with the emission of poisonous gas from the carbon-fueled engines, not even his nose mask can save him.
Protect myself from the dust in the system, the dust in the weather conditions in around here. It would help me to at least have a clean breath of air. So that's why I normally put on my nose mask. And especially when I use the trotro and stuff, people might come in with all sort of perfumes, in which might not be that best for me. I was in a private vehicle with a colleague, and there was a trotro nearby, in which they were really polluting the air with smoke. So I pleaded with my colleague to roll his glasses and on the AC so that it wouldn't be having so much effect on me. Yes, so I do experience that a lot.
Asthma is a global concern, with the World Health Organization reporting 262 million cases and 455,000 deaths in 2019. In Ghana, the impact of asthma on non-communicable diseases is striking. Since 2020, there have been 2,772,157 cases of non-communicable diseases across the country, with asthma responsible for 239,036 cases, ranking third after hypertension and diabetes. In 2021, 84,700 new asthma cases were reported, followed by 79,355 in 2022. Even more alarming, from January to June 2023 alone, 36,780 new asthma cases have emerged.
I use my inhaler almost every day. I have two different kind of inhalers that I use. I use the Ventolin. The Ventolin when my situation is becoming a bit severe, that's when I use. But my Serotype, I take it every day. Every day I use it just to clear my chest
People with asthma have to resort to their medication every day, and these medications don't come cheap.
It's quite expensive to be getting those drugs almost every time. It's until I joined the university, I used to buy myself, and you have no option than to buy because you needed it daily. It affects your budget.
For Reuben, nobody cares, not even the policy makers. This time, he wants something to be done about the degrading quality of air.
Regulations are not being put in place to ensure that people like myself are well protected. So you have to ensure that you give yourself the full protection as much as you can to be on the safer side. Yeah.
The challenge of air pollution is exacerbated by the scarcity of monitoring infrastructure in many areas. Even with the limited number of monitoring stations scattered across the country, the data paints a disturbing picture of deteriorating air quality. For those particularly sensitive to these changes, the air has become an unwelcome adversary rather than a source of life. For Joy News, Michael Ashale.
So there you have it, some effects of this deteriorating air quality that we're breathing. And it's not just a Ghana case, it's global. But here's some interesting facts that I want to bring to your attention before we get into the conversation. Of course, we just established that air quality is now the second largest risk factor of death globally, according to the State of Global Air Report 2024. A report was put together by Health Effects Institute and Institute for Health Metrics and Evaluation. Now, the report indicates that air pollution is linked to more deaths, that is 8.1 million more deaths than tobacco use worldwide. It also reveals that air pollution is responsible for death of approximately 700,000 children under the age of 5. Now, these statistics mean that around 1,917 children die every single day due to the devastating effects of air pollution. The report also highlights that Africa is significantly affected, with many regions experiencing some of the highest levels of air pollution. What does this mean? And in the Ghanaian context, how do we move forward in this? Two distinguished men are joining me this morning to get into the conversation. Dr. Reginald Quansah, Senior Lecturer at the Department of Biology, Environment and Occupational Health at the University of Ghana, and he leads a Clean Air Fund project. He's in the studio with me. Dr. Reginald Quansah, welcome to the studio.
Thank you.
Also joining us on Zoom is Desmond Appiah, who is country lead for Clean Air Fund. Desmond, if you can hear me unmute, good morning.
Morning, and thank you for the invite.
Great. So I had a chance to go through the report, the State of Global Air Reports 2024. And one thing that, really caught my attention is that the United Nations General Assembly has formally declared access to clean, healthy, and sustainable environment is now a universal human right, especially for children. But does this right goes unfulfilled for billions of people? That's the situation that we find ourselves in. And at the end of this conversation, we are hoping that we would have explored the Ghanaian context of this air pollution, find out ways that we can move forward, and also talk or focus more on the Clean Air Fund, the work that you are doing there. So to start off the conversation, can you elaborate on what this means for Ghana, considering our local context? And I'm referring to air pollution being the second largest risk factor for death, Doc.
Yes, thank you very much. Ghana is not doing very bad in terms of managing our air, if you compare to other West African countries. However, we know that air pollution levels are consistently moving up. We know the EPA is quite putting in some efforts, but there are several factors that account for this. I think one of the things that is very obvious is emissions from vehicles. And those boils down to our policies on regulating emissions from vehicles. Another thing we can also quickly comes to mind is residential garbage burning. We have some policies on that. If you go to the districts have been mandated to manage emissions from garbage burning. But again, it's something we do on a daily basis. Then the dust from our roads, dust from the Hamatan, and then also, more importantly, household air pollution. So those activities are done indoors, but nothing, the smoke wouldn't stay indoors, it eventually comes out. So there are several issues that accounts for the consistent increase in air pollution in Ghana.
Okay, let me come to Desmond Appiah now. Desmond, you are country lead for Clean Air Fund, and this, statistics is alarming. What do you make of it in the Ghanaian context?
Thank you again, and good morning, Doc, and good morning to the viewers. The statistics are stark. The last report that was released on the state of global air quality showed that there were a little over 7 million deaths from air pollution-related diseases. Now, this new report is saying over 8 million. So it gives us a sense that it's already jumped up. Again, the report highlights that a large number of these deaths are occurring in Southeast Asia and Africa. And so for us, and Ghana is in Africa, and so we have to be quite concerned about it. Then you mentioned again about the children aspects and the UN resolution, which is making access to clean air as a fundamental right. All these things are concerning because there should be concrete actions on ground to indicate that we are bent on ensuring that our people have clean air. The difficulty, however, is that there is not enough information to help us establish clearly the status. We have some monitoring that has been happening by EPA in Accra for over 20 years. But the rest of the country do not have that kind of infrastructure to support. We also have some monitoring that has been supported by the US State Department, the World Bank, and also the Clean Air Fund. But all these are mainly located in Accra. And we are trying to now work with the EPA to look at other parts of the country. So the data is extremely important because it helps us to establish the status quo and not to be making anecdotal decisions. In the Ghana situation, we have some laws, but there's a lot more that we need to be doing to be able to push the needle. The challenge, large challenge that the clean air field faces is that the quality of the air is not seen. So we call it like a silent killer. We are in a room, we are breathing air, but we may not see that this is the state of the quality. And there is a huge disparity. More people are vulnerable when you look at our communities. And this is even more stuck in Ghana, where you have areas where there are rich people, good tree line areas, but the vulnerable seem to be living more closely to the key sources.
Right.
Doc mentioned some of these sources, but industry is also one. And you go to some areas, you will see that there are shanty towns around there, and people are more exposed. The kind of fuels that they are using, and it's making them more exposed. So then the health systems to support even when there are issues. The short documentary that you showed, the person in there mentioned that the cost to them is so high. So you can imagine people who are more vulnerable, maybe lower level economically in the society, being exposed to more pollution. So the disease burden is even higher for those people. Yet the economic impact on them, it's greater. So the level of the informality that we have also plays a part, and we need to be looking at all this in the Ghanaian context.
Both of you have mentioned emissions and policies, government policies to ensure that we are at least tackling this from the roots. And we know that there's a ban on import of old vehicles. There's also that emissions levy that's trying to discourage the import of old vehicles so that at least we reduce the transmission in the air. So my question to you, first to Doug, is how effective do you believe the current government policies are in mitigating air pollution? And what additional steps should we be looking at?
Yeah, thank you very much. Fortunately, we had some support from Clean Air Fund to look into some of the barriers to implementation of the policies and the regulations. I think there are a lot of areas that were touched on. I think education is something that is lacking. Most people in the country are not even aware of the effects of air pollution and even the existence of certain policies. There are also areas of technology. I think there are institutions that have been mandated, as Mr. Appiah said, to monitor. We need data to make decisions. And EPA started with quite a number of reference grade monitors. Now they can talk about 5 or less. And now we see...
Is that enough?
It's not enough. And now we see, by the help of USA Department, State Department, and also Clean Air, and influx of low-cost sensors into the country, which is, of course, supporting, but reference grade monitors are very expensive. And so these low-cost sensors are very supportive in establishing that, supporting, helping us to get enough data to make decisions. Again, there are other issues that were touched on, such as funding. One thing that Mr. Appiah highlighted on is the fact that we don't see air pollution. It's a secret killer. It affects everybody, rich and poor, name them.
Yeah.
And so, yes, I think there should be, there's lack of collaboration among and between institutions. In Ghana and like most African countries, everything is left at the doorstep of the government. Where, because it's a thing that affects everybody, I think institutions, companies can come into support. Where there's a need to get some monitors to do monitoring, I think some institutions can come in to support. In terms of policies, there are quite a number of policies, but we realize that its implementation is what is lacking. And probably we'll talk a bit about it later, what are the barriers to the implementation of these policies. We have quite...
We can touch briefly on it. So let's take, for example, the emissions levy. What are the barriers when it comes to implementation of this policy?
Yes, emissions, yes, when it comes to the emissions levy, though most countries are implementing something similar to this. But the fact is that are we actually putting levies on people who are causing the pollution, the most who are contributing a lot to the emissions? And how are these people contributing to the levy? I don't know the mechanism that goes into it, but I think it's very useful, but the implementation, if it's being implemented well, we can get some money to support other areas that we can help to minimize, improve the air quality. So, for example, if you have vehicles emitting, old vehicles on our road emitting a lot of pollutants, how do you tax them, for example? And most of the emissions on our roads are from very old vehicles. Although we have some policies on banning of old vehicles, but they still get into the country. What is happening at our ports? And so if emission levies could be effective if we tackle it from different angles. Okay. If we allow old vehicles to come in, and even if we also fail to equip the centers, emission centers, because most emission centers, my understanding is that they don't do the emission testing. So what they do is that they look at certain things that will help cars pass on, and they come to the road. And so I think
just like our roadworthy system, you know, you just pay something small and then you slap a ticket on your car and then you're good to go.
So I think if we want to consider the emission, the levy, we need to look at the broader scope of things. Okay. Then one of the things we could do is to equip the centers, so cars that are prone to emit more pollutants don't get onto our roads. Probably we don't allow old rickety vehicles, which have a short lifespan on our road, to be on our road. Yeah, so I think we need to look at it holistically.
Okay. Let me come back to Desmond up here. Desmond, so Doc is saying data gathering. These are some of our challenges, education and then funding. Do you agree with all these? And where are the gaps that you have also identified as country lead in the implementation of these policies?
Yeah, thank you very much. And Doc is really spot on. I think I would add a bit more to what he said. If you look at the issue of the emissions levy, for instance, if you want to use emissions levy as a tool to reduce pollution, the way you target it is different. What I think we were trying to introduce in Ghana, in my humble opinion, and this is my personal opinion, I thought was more of a revenue generation tool than an emissions reduction tool. Mainly because Ghana operates a polluter pays system. That is why when you generate the waste, you pay for the collection. When you have a vehicle and it's polluting more, you're supposed to be paying more. And so it becomes an incentive scheme for people to reduce their emissions from vehicles. If you go to countries like India, they have similar policies, but on the vehicle age and what vehicles can be used, how many years the vehicles should last are there. We in Ghana have similar policies, and we need to be able to implement them. And I think Doc will talk about the projects that we are supporting them to look at the barriers, why some of these things are difficult. But we have a polluter pay system, and we need to build awareness. Anywhere in the world where you are introducing what people may see as a difficult tax, you need to build the awareness and consensus before you bring it in. In the case of the emissions levy, I'm not so sure that happened in our system. And that is why maybe the pushback was so high that it became a political issue. We need to build the awareness, gather the data, show that the pollution is causing maybe X factors, X number of deaths, the impact on individuals. World Bank has reported Ghana's economy loses over $2.5 billion, $2.5 billion a year to air pollution or air pollution related issues. So that is a solid case. Where does that money go? Well, it's part of, like the report you said, the number of people who are sick, do not go to work, have to rely on other structures for support, the disease burden that is going up. There are some constituencies or districts we are working with in Ghana. And in the past 5 years, their data is showing that the top 3 causes of diseases in or hospital attendance in their districts are related to air pollution. Now, the economic cost to all these things, to the state, and Clean Air Fund has a report called From Pollution to Solution, which looked at Accra and its impact. Even investors' decision-making these days are based on environmental factors as well. So we go around trying to get foreign investors to come and invest in our country. They are looking at the factors that they should be concerned about. If we are high up the pollution chain, it affects their decision making because nobody is going to come and put their stuff into an environment where pollution is so high. Okay. If we look at other sources like the e-waste, there is a whole program that is supported by the EU to make e-waste recovery into what we call sound recovery. We should look at that. So the key challenge is that there are projects, programs in Ghana existing already that we need to check their impact, their effectiveness, and see what things we can do to tweak it to make it work better. All right. I would touch again on the vehicle age that you mentioned. Ghana has standards of emission for vehicles. EPA, Ghana Standards Authority, DVLA have worked on this, but it is not mandatory. The emissions aspect from vehicle testing is not mandatory. And so how do we work together with all the stakeholders to get to a point where it is mandatory? So you take your vehicle, they check it, they take the information, but it becomes mandatory. And these are areas that we want to be looking at. I'll just mention without explaining 3 key things that we need to also be paying attention to. There's a new bill by the EPA, Ministry of MESTI in Parliament that has been there for a long time. And that bill has aspects which would tackle or bring to the fore some of the air quality related issues. I think it's been there a while. We're really praying that it passes so that we can work with local authorities And in that bill, localizing the action, which is one of the key concerns, localizing action is very important. And capacitating the local assemblies, because that's where the rubber hits the road. Then again, waste management is a major source of pollution in our country, as Doc referenced, major source of air pollution. And that is an area, we have a whole ministry to look at waste management. And so it is not possible to say there are no policy interventions, but we need to make sure it works. Right. How are we tackling, giving effect to these policies to make it work? We even have a tax on waste. And so if it comes to issues of the funding and the like, it is a retweaking of the structures to be able to address, capacitate the institutions that have those responsibilities so that they can get it going. And then all the things that we are doing is an add-on, which is building the awareness, building demand so that there can be accountability. So these are some of the basic things that we have to be looking at.
From what we've discussed so far, the problem is in two folds: human activities, burning, emissions, and all that. And then the structures in place, lack of education, funding, policies that actually work. So let's talk a little bit about the work you do at Clean Air Fund and how, since we are the ones causing the problem, I should throw that question back to Desmond. And how are you including citizens or communities in ensuring that our actions are at least, mitigating the effect of air pollution on our lives?
Thank you very much for this question. This is extremely important. In fact, the fundamental work that Clean Air Fund did before starting in Ghana showed that there was no demand for clean air in Ghana. Even reportage on air pollution related issues was very scant. And there's a doctor at the University of Ghana who has done extensive work looking at the reporting on air pollution related issues in the country. Clean Air Fund, because we are very equity focused, and that's why mentioning about the vulnerable in our societies, the communities that are vulnerable, women, children, they feature very high in the design of the projects that we are working on. And so we are very conscious of that. We are also working on a number of projects helping to address this data gap, which we've mentioned earlier. EPA has been doing great in that based on the constraints that they find themselves in, and our work together with other partners is to augment what they are doing. And we are very glad that they've been a great supporter in the work that we've been doing. We're already working with some select districts in Accra to be able to help them translate the air quality management plan that EPA has into local action plans, local air quality action plans. So that means bringing the issue straight into the jurisdiction. So if I use AMA as an example, AMA's sources of pollution, air pollution, may be a little different from maybe Adenta or East Legon. So we want to situate the actions that AMA should be taking within their context. And that is what that project is seeking to do. And we should mention here the support that we are receiving from these select assemblies on that. I've mentioned also about waste. We have a project which is currently running with a Green Africa Youth Organization. They have run a pilot project in the Ladma district where they were taking out plastics and organics, and we are trying to scale it up. It's a good idea. We think we should scale to 5 other districts to be able to do this. The way Clean Air Fund is set up and works is that we work with partners. We co-create the initiatives and work with partners. Right. We don't do direct delivery, but we work with partners to be able to get the results that we're looking for. Okay. We've had about 8 projects that are virtually running their cycle. We have another 6 that are ongoing, and we have a couple more projects that are also going to roll out this year. One of them being the Breathe Cities project that Accra has been, is a part of the cohort, and mayors have made commitments and other chief executives, and we are working on that. Its pillars include awareness creation. One of them, a key pillar, is awareness creation, capacity development, technical support, and also data. And so, and the Breathe is a vehicle that we are working with to ensure that there's delivery in these cities with a target to help reduce by 30% the waste burning, open waste burning that we see in Accra. And so that's a very specific target, and also to reduce pollution by 10%. from vehicle. And there are specific initiatives that we want to roll out. And then we are working across the country, including the projects that DOC is leading and other projects which are ongoing.
Okay, so these are projects to help mitigate the deteriorating quality of air we breathe. I mean, hopefully it will be lesser than PM or particle matter 2.5, which I hear is the standard, right? So in the interim, I mean, while these projects are going on, how can we individuals protect ourselves from these emissions, I mean, from the pollutants that we're breathing in on a daily basis, Dr. Quansah?
Yes, I think these pollutants are being created by us, right? If it comes to garbage burning, it's being practiced by people. And so if you can minimize, and it doesn't happen in isolation. If you don't have any company coming to collect your waste, what do? You can't allow the waste to pile up. So you need a support from the system. So the system, there should be a creation of a system that at least once you create the waste is disposed of. So and that's a challenge. People pile up their waste and then they have to make sure they get rid of them. So yes, we should minimize those practices. And also, for example, one of the key things, if you look at the Health Effect Institute reports, I think the chunk of the burden is attributed to household air pollution. Again, individuals can play their role. But you can minimize the use of biomass fuel. But what you can do at your own level is you can minimize self-exposure. At least if you are cooking in the kitchen, don't stay there for a long time. If you are pregnant women around, keep them away, keep the children away.
You say if you're cooking, don't stay in the kitchen for a long time?
For a long time. You put
Why is that so?
You put the pot on the stove or on the tripod, the stove. Just stay away from the kitchen. Wait for some time. You know when the food will be cooked. So the time that the food is cooking, don't be in the kitchen. Just stay away. Those are the things you can do to.
Does that apply to all forms of burning gas? Are you talking about LPG?
I'm talking biomass. Yes. Biomass. Those are the key things we are talking about. So we can minimize our exposure to household air pollution by staying away from the kitchen when, at least making sure our children don't go there. Right. But again, we can't help it if you don't have money to buy LPG. You can't help it than to use a biomass fuel. But at least you can, at your own level, you can do certain things to make sure exposure is minimized. Okay. And also, for example, if you have kids who walk along the road to school, you can identify a less polluted street and then walk your children. You try to walk them to school using that road for some time. Then you advise them to use that road. So there are certain practical measures we can use to minimize exposure to some of these pollutants. At the individual level, yes, so it may help. But if we don't, I think as Mr. Appiah said, it's education. Most people are not aware that the smoke that that is coming, or the smoke that they are walking into, may affect their health. So education is key.
Should we be wearing masks?
Yes, mask is very important. Mask is sometimes very uncomfortable anyway. If it's very humid, it's very hot, it's very uncomfortable wearing mask. But at least there are certain things you can also do in addition to wearing masks. Okay.
David, you have, Desmond Appiah, sorry, you have the final words. And then you can tell me about your plans for the next 5 years. I'm talking about the Clean Fund project.
All right, thank you very much. And I think, as Doc has mentioned, there are lots that we can be doing. We can also continue like Joy News and all your channels are doing to continue to bring this issue to the fore. We need to be asking our policymakers to be telling us their solutions. You know, to deal with air quality related issues, it should be seen as a development issue. And the propositions that we are hearing, we should be asking the policymakers, how do you intend to improve transportation but not increase air pollution? We need to hear those solutions. We are a solutions-oriented organization, and we want to be pushing that angle. And we are glad that media partners like yourselves, the researchers, and other CSOs are also supporting in this direction.
Right.
In the next 5 years, Clean Air Fund will continue to advocate for clean air for all. And as I mentioned earlier, equity is very important. We are very glad with the UN resolution, and we are working with various stakeholders from government to local government, CSOs, academia. We want to be able to put the research and the evidence in the hands of the policymakers so they will make informed decisions which can go to address, mitigate the sources of the pollution. And we want to be able to build capacity of our citizens to be able to demand for clean air, because ultimately that is what we should be asking for. All
right. Desmond Appiah is country lead for Clean Air Fund. Thank you so much. And in the studio with me is Dr. Reginald Quansah, Senior Lecturer at the Department of Biology, Environment and Occupational Health at the University of Ghana and leading a Clean Air Fund project. And that's how we're wrapping up for this belt of conversation. But a dedication here. Happy birthday to Marvin Bentil Frimpong, a.k.a. Papa Kwesi, from Doorbell International School, Somanya. This is coming from your mom, who's a midwife, Helena Kitete of Nabita Hospital in Tema Community 4. Happy birthday to you. We'll take a break now and we'll come back and then wrap up. Stay with us.